Welcome to IVAC's World Immunization Week webinar series. To kick us off, we have Dr. Naor Bar-Ziv, Deputy Director and Director of Epidemiology at IVAC. Before we get started, I want to let participants know that we will have a short Q&A session at the end. So please enter your questions into the chat box, and we will get to them after the presentation. Any questions we do not address, we can follow up individually with after the webinar. This webinar will be recorded, and thank you for attending. I'll now hand it off to Dr. Naor Bar-Ziv to introduce IVAC in today's presentation.
Thank you, Andrew, and thanks everybody. Hello and welcome to the second session this week of World Immunization Week seminars by IVAC. For those who attended yesterday, you'll bear with me for a few seconds as I describe IVAC to you. And for those who have not yet participated, we welcome you to join us for the rest of the week also. So the International Vaccine Access Centre is an academic and an applied public health centre based at Johns Hopkins University at the School of Public Health. Our focus is on accelerating global access to life-saving vaccines through the development and implementation of evidence-based policies. And we work across a range of practice areas over a whole host of pathogens. That list is unfortunately now longer because of COVID-19. And our aim really is to generate and to synthesize evidence which is policy relevant and to help integrate evidence into policy to facilitate access to vaccines with the hope of impacting on child and adult morbidity and mortality globally. Next slide, please. So the IVAC team consists of about 50 faculty and staff. We are based across the whole globe, really, with partners in country across 40 countries. We're now in our 10th year. And the team at IVAC is very cross-disciplinary. We have physicians, clinicians, academics, economists, epidemiologists, researchers, social science researchers, policy specialists and advocates. And really, we try to tackle problems through all of their elements. This week, we have the pleasure of presenting now 3 more sessions, today's session, and then 2 further tomorrow and the following day. The upcoming session will focus on whether we have the capacity to deliver COVID vaccines to older adults. Will be presented by Lois Privadam. And then the final session will be about protecting existing vaccine programs, not losing ground really with their achievements in the era of COVID-19, which will be presented by Anita Shedd and Bill Moss. Next slide, please. So it gives me great pleasure to present our presenters today. Dr. Victoria Chu is trained as an infectious disease epidemiologist. Her recent work has focused on the application of modelling approaches for estimating the impact of key maternal, neonatal and child health interventions in low resource setting. You may be familiar with the LiveSafe tool, which is her work. She's worked with diverse stakeholders in global health to advance the use of evidence-based approaches for strategic planning and advocacy and for program evaluation also. She's the project lead for the Value of Immunization's Compendium of Evidence, or what we call VoICE, which is what we'll hear about today, based here at IVAC. And she oversees the collation of the scientific evidence base about the broad benefits of immunization. Alexandra Michel is a communications associate based on sitting on the policy advocacy and communications team here at IVAC. She started recently, and we're very happy to have her. She's brought a lot of energy and a lot of focus to her work. She currently is also working on VoICE, and previously has worked in science communication and advocacy across a wide range of public health and behavioural science topics, with a focus on making research accessible to policymakers, to non-academic audiences, and to the general public. So without further ado, I'm going to hand it over to Victoria and Alex. Thank you very much.
Thanks, Naor. I hope everyone's having a good World Immunization Week this week. This is Alexandra. Next slide, please. So this is a quick overview of what we'll be covering today. First, we'll go over what VoICE is and how to use it, and then we'll go over a few case studies that highlight some of the evidence and resources included on the VoICE website. We'll have about 20 minutes at the end for discussion and questions. Next slide, please. So VoICE is a website that includes a database of evidence about the broad benefits of vaccines. So not just morbidity and mortality data, but the more far-reaching implications that immunization has for benefiting us economically through equity improvements, educational attainment and productivity. Immunization really touches people's lives in a lot of different and important ways. So part of the value of VoICE is that it bridges some of the gaps between the research community and the advocacy community. Fantastic new research is coming out all the time, every day in fact, but it can be really overwhelming and challenging to try to sift through all these journals to stay up to date, particularly when you're working in advocacy and you may not be focused on a single discrete topic or a single vaccine. So every month our team at VoICE conducts a literature review on PubMed for new peer-reviewed research on the broad benefits of vaccines. And then our team sifts through this evidence to identify research that's really high quality. We take these long, 2,000 or 3,000 word scientific articles that might take a couple of hours to read carefully, and we boil them down to the main relevant findings in a summary that's typically less than 100 words. So you don't have to be a health economist or an epidemiologist or a professor of international health to understand the main findings of a study. The database, the VoICE Compendium, includes over 450 of these summaries from over 300 peer-reviewed sources, and these are searchable by key term, by vaccine, and by WHO region. So you can skim through these short summaries to identify the evidence that you're looking for much faster than doing your own PubMed or Google Scholar search. It just really puts the evidence at your fingertips. Next slide, please. So I'm going to show just a short video that demonstrates some of the different ways you can search for information using VoICE, and just sort of how easy it is also to find the original journal article and the citation for that research. So here you can search by vaccine or pathogen. You can also search by WHO region. And then you can see these summaries of the research that include a link to the original publication. Next slide. So our first use case, we'll say I'm working on a presentation. I want to highlight for policymakers some recent research on the economic benefits of vaccines they should really be thinking about in their policymaking. Next slide, please. So instead of heading over to PubMed to search for research on this topic, I can go to the VoICE website, which is immunizationevidence.org. Hopefully everybody's got it bookmarked now. I know I'm interested in economic issues for this presentation, so I would click on the economics topic button on the left side of the screen. That shows me some different subtopics that I can choose from. If you click on a subtopic, in this case, I'm interested in poverty, you get a list of key concepts. These are very short summaries on a body of research on this subtopic. So I'm interested in this third one down. Vaccination can help people avoid economic impoverishment resulting from medical costs. If I click on View Evidence in orange, that pulls up the study summaries. In this case, I can see there are 3 studies included in VoICE on this concept that I'm interested in, preventing medical impoverishment. So I can really efficiently look through the findings of these 3 studies to find the type of data that I'm looking for instead of spending a few hours digging through tons of study abstracts that may not be relevant for me. Next slide, please. So here's an example. This is sort of a landmark study that was published in Health Affairs in 2018, showing that immunization could prevent an estimated 24 million cases of medical impoverishment between 2016 and 2030. This summary is very helpful. I can see that this study provides information that makes a really powerful argument that I could use for my presentation or for an op-ed. But I really need to know a little bit more detail about the study and the findings. So if you need information that's somewhere in between a 100-word summary and the original 3,000-word Health Affairs article, VoICE also includes a resource called Featured Issues. For these, we take a deeper look at a topic like this medical impoverishment study, and in around 1,000 words, we synthesize the evidence on that topic more deeply. In this case, the featured issue on equity and poverty reduction takes a really close look at this particular Health Affairs study It makes it much easier to understand for someone like me. I am not an economist. So it goes through the model the researchers used, it goes through the limitations of the study, it defines some of the jargon and technical vocabulary. It just provides a lot more context and detail about the research methodology and the findings, which makes it just much easier to use if you're presenting to policymakers or stakeholders, the public, for journalists. We typically publish new feature issues once every few months. The next one coming out is going to cover maternal immunization, and that's scheduled to be published in May around Mother's Day. Next slide, please. So if you're working on this presentation and you really want some visual assets to help communicate the findings of this study, VoICE also includes a media library with infographics, social media content, videos, and documents that are free to download and use. So you can download some of these infographics on poverty to use in your presentation to help clearly communicate some of the big impacts that vaccines have on helping families avoid medical impoverishment. They say a picture is worth 1,000 words. So this is a resource to really help advocates effectively communicate with all different types of stakeholders. We're adding new content to the media library all the time, and it is also searchable by topic or the type of media. And at that, I'm gonna hand things over to Victoria.
Great, thank you, Alex. So Alex had sort of highlighted some of the nuts and bolts for how the website is organized and how the platform is sort of strategically or theoretically the framework of it. And so related to those 6 key topics that we mentioned, health, education, economics, equity, one of the ones, what we wanted to do is just sort of take time to go through 2 more sort of what we're calling use cases, but really these are sort of broad concepts that folks that are immunization stakeholders involved with developing immunization programs, or really stakeholders have been involved with. And, I sort of want to say, we're delighted and excited that you were spending the time with us to learn about the tool, because really VoICE is standing sort of on the shoulders of giants. So it's both folks that are using this information or presenting it in ways and to drive change to improve health, as well as the researchers, sort of our collaborators internally, externally, that are producing this evidence. And the idea is for that insight and that information to get out to the widest possible audience. And so one of the ones which, we've had this in there for quite a while, so it's sort of more timely or has become more timely, is the relationship between immunization and outbreaks. And so next slide, we sort of wanted to look a little bit at, on the left, as I mentioned, one of the key areas, the 6 bars in blue, under global issues, one of the ones that we had already had before all of our world sort of shifted dramatically is outbreaks. And so when you click on outbreaks, there are about 7 key concepts. And so Alex had highlighted how these are sort of crafted. And so we've just pulled out 3 of them to present here, but there's sort of three key concepts related to what is the relationship, or how would I be interested in framing a discussion about immunization programs, about vaccines related to outbreaks. And so, there are a couple key things that different individuals, depending on their backgrounds, depending on their individual projects or perspectives, would be interested in exploring. So one sort of is looking at, first one is looking at the return on the investment. So for folks that were able to join us yesterday, for colleagues that look at the economics. So what are the implications related to the return on the investment for being prepared? And obviously part of that preparedness platform is one of the key pillars is going to be vaccines. Then the other ones are also similarly related to costing or economics, which is, how do outbreaks of vaccine preventable diseases, what are the consequences, and we know they can be pretty devastating. How can those consequences, how do they impact health systems and governments? And so when you click on, as Alex mentioned, the view the evidence, what would come up is a brief summary of some of the key papers. And so some of the key papers related to either an analysis or a review or something that would provide insight about what is the relationship between sort of these outbreaks occurring and the economic or other consequences that health systems or governments would be facing. And so the third one is just another one related to productivity losses, et cetera, indirect effects. But, you know, what this sort of highlights to us is there's a lot of information where people are like, you know, we really focus on the so what, you know, when researchers are writing papers, they write the introduction, they write the methods, and they write the results, and they write the discussion and the conclusions, and it's, you know, 3,500 words, and they're beautiful figures, and they have spent months to years sort of collating, collecting, analyzing those data, and it's really hard. It's kind of like when you're at a cocktail party to say, how is this important to me? What is the significance, and why is this important? And why does this really put an exclamation mark at the end of the importance, or to underscore sort of immunization as an intervention? And so for us, we've sort of tried to look at this as many different ways as we can, both by categorizing those 6 key topics, the blue bars on the left, and then within each one, as you can see, like antibiotic resistance, these are sort of issues in global health that come up. But how does that relate to, for example, immunization? And so next slide, one of the, as Alex also mentioned, one of the other ways that we've sort of tried to look at a topic would be in sort of this more holistic, both in sort of breadth and depth, to kind of really do a deeper dive into a specific topic. And so these featured issues come out you know, a few times a year, but are really intended to kind of be a thoughtful sort of deeper dive into a topic. And so this would be something where, you know, it's synthesizing the existing evidence base with some either original infographics or some original language to understand, again, not in sort of research speak, but how does this all come together and what does this all mean? So the featured issues also, again, are try to address something that may be a timely issue. It may be obviously an emerging topic, or it may be just a topic that there has been a recent body of evidence developing, and sort of how do we put that in context with the greater, all the work that others have done. Next slide. So for example, one of the examples that we just sort of wanted to highlight, which obviously is relevant, again, much more relevant sort of in today's case, is highlighted by the recent struggles of the pandemic, where people are looking at healthcare workers. And so human resource cadres, what are the risks in terms of infection, and what role can immunization play to sort of protect and ensure the sort of resilience or stability of a health worker cadre. And so first, as you can see sort of at the very bottom, all of these sort of conclusions or summary statements are always going to be tied to the primary literature. So, you know, if you really wanted to know, you know, when that study was done and it just mentioned West Africa, or when that study was done and it mentioned Sub-Saharan Africa, which countries in particular were they talking about? Either because I'm working in a context-specific program, or I'm working in a specific region, and I just want to know sort of perhaps how relevant that is. Is it in the context of South Asia? Is it in Ethiopia? Is it in Latin America? And so the references for all of that information would always be available. And you know, we've sort of, Alex mentioned sort of the process of updating the database, but all of that remains fully traceable. So as we're sort of trying to draw more summary conclusions, we've made sure that you can still, if you wanted to, sort of go all the way out to the branches, or out to the branches and see the leaves on the tree. So if you did want to click and go into PubMed, pull up that primary, that white paper, you would still be able to do that. You'd have all the information, and you wouldn't just have a vague notion that it was a study conducted in Ghana 3 years ago. So next slide. The second use case we just wanted to talk about was sort of the idea that immunization strengthens health systems, and our webinar was exciting in the sense that we sort of could show some of the new content that have been developed and some of the new features for VoICE, but it's also a little bit different because we ourselves, we're not sort of presenting this is the current evidence base, but we're trying to say, this is the platform, this is a way for you to really put your finger on the pulse of all the different research and all the great work that's coming out. And sort of it's, I don't want to say universally known, but it's sort of very commonly known. It's the idea that a strong immunization platform is going to strengthen the health system. A strong health system is going to be able to deliver reliably and sort of at scale vaccines to vulnerable populations. So, you know, how do we understand how that system is kind of like a car battery recharging itself? What is the interplay between those two key elements? Next slide. And so we you know, we have leadership and we have I would say broad statements, but we have these conclusions that we know, yes, routine immunization is critical. When outbreaks occur, they can, you know, overwhelm a health system. And so, you know, it's sort of amazing that when we had prepared or sort of discussed this, the format or the examples for this webinar, I think now even like 5-year-olds know flatten the curve. And so one of the ideas is, you know, for immunization, what is the benefit that could be gained by a country's reducing the burden on a health system? And so for us, you know, we focused a lot, epidemiologists are very good about collating the direct benefits of immunization, of understanding, you know, the reduction in the incidence of pneumonia or severe cases, et cetera, reduction in morbidity or mortality. So for us, we're really trying to zoom out as part of VoICE to understand what are all of the broad benefits and what are sort of all of the direct, indirect, incidental, et cetera. I don't know how many adjectives you want to use, but the idea is, you know, you'll be able to find a study that will compare vaccine A to vaccine B and demonstrate the equivalence. But we're sort of trying to find out what are those studies that are looking at sort of either from a health systems perspective or from a health worker perspective or sort of from a different lens. And that information is harder to pull out from PubMed because you sort of need more general terms. And so what we're really trying to do is find a way for folks to get the information that they need, supported by strong studies and a solid evidence base, but without having to read 200 papers. So next slide. The last part I just wanted to highlight was related to the immunization and the burden on health systems, and this exactly was mentioning what I just described earlier, which is, you know, to reduce the pressure or the burden on health systems which are already going to be struggling. And so, you know, here we've pulled out in sort of bullets the exact study findings, and depending on sort of what your application is. So if it's talking to policymakers, if it's talking to the public, if it's talking to other advocacy groups or other sort of child health proponents, knowing when do I want to be sort of broad and present the conclusions, and when would I want to back it up with these are the exact numbers, this is the percent decline, this is the exact sort of findings, so that it's not too, doesn't feel too non-specific. And I want to double check before. Yes, so before I turn it back over to Alex, I just sort of wanted to highlight so 3 main sort of takeaways. One is this work has been ongoing, and again, I have been amazed by sort of all of the work that has been done to thoughtfully develop this compendium of evidence, because there are so many different ways to do it. There's so many considerations in terms of who the audience is, what their needs are going to be. And so it's really sort of been a beautiful work in progress. And a lot of sort of thought has gone into each component. Second to that, though, is that it is a platform or tool that continues to evolve. And so Alex had mentioned the media library, which is great because now we're much more used to seeing a really nice figure or a really nice summary graph or a really nice infographic that lays out for us some of the key points. And so having those images or those tools accessible as resources really sort of, we're hoping, facilitates your work. And the last thing, which I am going to pass it over to Alex to mention, is we hope you've learned a little bit about sort of what VoICE is able to do, what the value of sort of what we've tried to collate and prepare is, and we hope you stay friends. I hope you stay our friend. I hope you tell your friends, because I think for us, we definitely value both the input and the feedback in order to guide sort of next directions and future iterations or revisions, as well as, you know, it's sort of one of those ideas that the value of the tool is only sort of enhanced by how widely it's used and by sort of both in terms of number and breadth. So we're really hoping that folks like it, are able to use it. If there's any thoughts or suggestions or feedback about any ways to improve that, we really welcome that dialogue. So with that, I really will turn over to Alex for the last slide.
And then we have many different ways for people to kind of keep up with us. So if you go to the homepage on immunizationevidence.org, there's a space where you can sign up for our email newsletter. So that typically is going to include updates to the site, new information, just generally anything new. And then we also are very active on Twitter. We just passed 500 Twitter followers today. So we also try to kind of keep the world up with what's new via social media. And then of course, please feel free to get in touch with us via email if there's something that you have a suggestion for, or if there's like a topic that's of particular interest to you, if you saw a paper or a journal article that you thought was really relevant and valuable, please feel free to get in touch with us directly. So thank you so much.
And with that, I think we're opening it up for questions. And I have seen, we had asked folks to please feel free to type in either questions, comments, or input on the chat. And I see Naor is actively answering some of our questions and doing our work for us. So I am delighted and grateful. There was one question, and I did want to highlight this, that the website isn't available in French. And so we have not expanded to 6 languages, but yes.
Yeah, the website is professionally translated into French. And we have been looking into the option to use a Google Translate plugin to also make the site available in numerous other languages as well. French was chosen because in some of the user feedback we got, that was by far the language that people asked for the most often. So a question that we received was, how can we make this the most accessible to those in country with low internet bandwidth? There were a couple of questions about bandwidth. So I would love to get some suggestions from anyone in the chat if they have any advice or suggestions for us. The site is mobile accessible, and my understanding is that it does work pretty well, but I know that different contexts and different circumstances, some resources may be more accessible than others, so video may be more challenging depending just on your bandwidth issues. So if you have any suggestions or ideas for things we could do to make the site more accessible in country, please feel free to let us know, and we can definitely look into that.
So another question was, how do you choose the evidence base for the compendium? In other words, how is it determined what gets added, or how, and Alex, do you want to answer? If not, I can fill in.
Yeah, so Victoria and I started fairly recently on VoICE as a project, and we actually, the process we use to select new evidence currently is very similar to a systematic review. It's not a systematic review per se, but we use a piece of software called Covidence that's used by the Cochrane Review for their systematic reviews to pull search terms from PubMed, and then we have like a team. And I think a real advantage too to our approach is our team is very diverse. So my background is in health promotion and social epidemiology. But there's also, in addition to Victoria, another person with a PhD. I think Matt's PhD is in epidemiology.
Infectious disease epidemiology. There's a policy person as
Yes.
well as sort of another person from sort of a global disease background. So I think I don't want to say, I mean, we start with, it's definitely, the framework is sort of a systematic review, meaning we're looking at peer-reviewed publications that are spanning both the sort of, I don't want to say casting as wide of a net as we can, but generally, you know, in terms of vaccine preventable diseases, in terms of, as we mentioned, sort of these key topics of health, education, economics, equity, health systems, each in and of itself is a huge area. And so the idea is to do it in a way that's systematic, that is routine. So in other words, it's what we have right now collated and available through the website is our best efforts to present information that is sort of so anywhere between 6 weeks, 6 months recent, as opposed to a sort of 6-year, that was a snapshot of what was going on and the evidence and what people were talking about and disseminating at that time. So there is a very intentional focus on keeping the information up to date and current as best we can. We still know there are lags in sort of publication or in study data being analyzed, et cetera. But that being said, it really is a process that we've tried to standardize in the best, sort of to make it as broad as possible.
One of the other questions we got are, what are some of the topics we've already written about in these featured issues? And are there any that get a lot of attention or that people are really interested in? So obviously the Outbreak featured issue, which was actually written in 2019, has become very popular. It's had a jump in popularity. Also, one of the sort of really perennially or consistently popular topics has to do with sort of the relationship between undernutrition and vaccination. People use that one quite a bit, but there's over a dozen featured issues and they span many different topics. One of the other more popular recent ones, we had some staff who went to the first global forum on childhood pneumonia. And so we have a really great one that focuses on childhood pneumonia. Another question, if I wanted to use one of the graphics, are there any copyrights I need to consider? No. So all of the media in the media library is licensed under a Creative Commons license, which means that it's free to use. So you're welcome to use it for free. There is a question, is the quality of evidence assessed, and does that affect what gets included?
I love it. What you got there, Rams? That's really pretty, Parker. I like.
Can everyone mute themselves if
one.
you're not talking, if you're not a presenter? Thank you.
Mama, eat this.
Yes, so we actually have a very involved sort of process for reviewing the evidence that it gets included in VoICE. And so some of that includes actually reading the studies really carefully and running the methods by a subject matter expert. So for example, neither Victoria or myself is a health economist, but one advantage to working at IVAC is there's a really great sort of diversity in people's areas of expertise. So we will, if we have a question about an economics modeling study and sort of the robustness and quality of the model, we will run it past a health economist to make sure that it sort of passes muster.
I was looking to see, related to the questions about sort of technical capacity, I think we addressed some of them in terms of our goal in trying to make it sort of as user-friendly and as accessible as possible is just sort of lower the requirements, but as we all know, it's sort of one of these challenges is that when you build these complex websites, then yes, they're going to require certain bandwidth. And so we can explore certain options, because I think the idea is for us, we really are trying to address and facilitate sort of what people talk about as like a South-South dialogue, or any of these lessons learned, that it is, all this information is not stuff that we're handing out to sort of our Hopkins colleagues by, for, and with the interests of sort of other researchers in mind. We really are trying to sort of broaden the base of to encompass and consider the needs of different stakeholders. And so I think for us, if there are, I don't want to say email me if you're having a problem, but let us know. I think for us, one of the challenges is knowing what are some of the constraints, what is the availability in certain areas. I think Naor did comment on the chat that he had been able to access it when abroad, but again, that feedback for us is remarkably helpful for development, because it is a little challenging for us to test either sort of being in DC or Baltimore or any of these sort of local places that it's going to be more equivalent. And so we'd be happy to sort of collate that feedback and try to figure out, troubleshoot if there are any things that we could do, any advances. And again, that's from the tech side, where we would have to engage team of sort of that support our web capacity. The other question I was going to mention was somebody, I have a question. So Naor, I am an administrator. I want to make a case for change. I need a one-pager on an issue to present to a key decision maker. Can I access a policy ready or close to ready to use resource from VoICE? So I'm going to let Alex talk about the sort of different ways that you might, where you might go, and then I'll sort of close with sort of my thoughts about, because unfortunately, I would say that most of the materials we prepare are a little bit longer than a brief, so it wouldn't be something where you would just download a one-page PDF with a little bit, just the logo on the back. But I do think we have options that would be really helpful. Did you want to, Alex, was there anything else you wanted to add in terms of policy related to resources, or anything else that VoICE would sort of be able to support or provide?
Yeah, so I think some of the best feedback that we received on VoICE in previous years when they were doing some of the initial user testing is that people who are doing a lot of work with policymakers or with the public or with journalists, they need to be able to communicate information very quickly to kind of hold those stakeholders' attention. It's not a given that people are going to care about what you have to say. You have to earn that. And so we really are trying to keep that in mind with developing new resources. And it can be a challenge. And I'm sure for people who work in an advocacy space where you're trying to balance, the technical accuracy of the original materials with trying to communicate it to people who are don't necessarily have the time and attention to, really learn the terminology and really learn all of the background. So it's a tough line to walk sometimes, but that's something I think we're really trying to keep in mind, is to keep the scientific integrity completely intact while also making sure that everything is something that you could communicate in like 1 minute to somebody who's maybe only half interested, to really wow them, to really get their attention, so that you can go in more depth. So again, we build this resource for you all. So if anyone has any sort of suggestions or resources that would actually be really helpful for you, please feel free to let us know. Feel free to let us know in the chat. Feel free to email us, because we are always sort of working on better ways to do this and better resources to really help make this easier for you.
And I think it is interesting because, as we talked about, I mean, we all can acknowledge that the evidence base continues to grow, and that sort of mountain of evidence just continues to be built. But I think the other options are, when I first started, social media was not as prevalent as sort of a mode for communication, nor were infographics. So sort of the whole expansion and explosion of data visualization is really fascinating to me, because it's true, in terms of having the media library, that's one way to sort of put something out there to address this, where in my mind, sort of the evidence base really is expanding pretty rapidly. But, we ourselves right now, for example, aren't making original graphs, et cetera. But at some point, is that something that VoICE could be incorporating, is really sort of scientifically rigorous, as well as easy to interpret and understand data visualizations about key concepts. That is clearly where global health and public health is going. And I sort of find it fascinating, because what I really like about it is that a lot of it is evidence-based, meaning, it's got roots in sort of cognitive science. So folks that are developing graphs or table, we're also used to looking at tables, and it's like, well, here's the p-value, and that's supposed to magically make sense to people. And now we understand, no, people are going to be able to understand, this area relative to this area, and how would the mind view that, and how does it view those colors, or how does it view those as a comparison? And that, I think, we're just sort of starting to scratch the surface and really get into, which I think is great, because again, it's if the information can get out there to more people who can use it, that's sort of our goal, and we'll have fulfilled our mission. So we're not sure if it's that, at some point featured issues become sort of a slide deck of infographics or something like that, but those types of things are not, would not be unfathomable, I think, at this point. So let us know sort of what you're interested in, and what you like and what you don't like. We're really interested in that kind of input.
And then we have a question. Hello, great resource. Is there information going up on how COVID-19 is disrupting immunization services? Looking for country by country information and more global figures. So VoICE we don't currently have this type of information on VoICE. We've been discussing some resources that we could potentially put together, but if you are free at 12 p.m. Eastern time on Thursday, Dr. Anita Shett and Dr. Bill Moss from IVAC will be talking about protecting vaccine programs in the era of COVID. So I highly recommend signing up and registering for that webinar as well. So that's April 30th, Thursday at 12 noon. And that's going to be focusing specifically on what do we know about countries who are responding to protect vaccine programs in the era of COVID?
And as our other, tomorrow, if folks are also able to join tomorrow's webinar will be specifically targeting. So as Naor mentioned at the beginning, Lois Pripordam will be discussing sort of, are we ready to deliver COVID-19 vaccine to older adults? So it'll be the same time, 12 noon. But it'll be sort of an exploration into all of those topics that folks are really struggling to kind of understand. And so that information hasn't made its way to our database or our compendium as of yet, but we certainly know that it's coming out quickly. And so there's a lot of really exciting, interesting work being done. Any other questions? I know I want to make sure we end on time, but I also want to make sure folks have our contact information. If Andrew, if you could scroll back to this Be Our Friend slide yes, exactly. So please sign up for our newsletter. We try to sort of send out information. Feel free to email us. And if you have a Twitter account or you tweet, I don't tweet, but I endorse our Twitter account. So any other questions or anything else? I sort of don't want to cut people off if they're pondering or typing, but I also want to make sure people, again, feel free to reach out. And Lois mentioned that the focus will also highlight, yes, the importance of vaccine resources we have today. Great. Well, again, stay in touch. This is sort of a preview or one of those like in a movie where you get the trailers. So this is partly what's been done, but like I said, hopefully it'll be a more to come. So thanks for joining.
Thank you very much, everybody. I just want to close off by saying that, you know, VoICE is there for everybody to use. It's designed as a resource. It's a voice for vaccines, but it's also a voice for users. And so we really see it as a communal effort, and we're very, very attentive to feedback. So please do forward your feedback. It's free for use, and we want you to use all the resources and images. But you know, if you do use them, and particularly if you're using them with funders, and you put in a plug and you say, "Isn't this great? We got it off VoICE." That will help us advocate for further funding, and then we can give you the PowerPoints that you wanted, and we can give you the little video snippets, and we can do all of that, and we can make things go faster and get the COVID work up as quickly as possible. And because all of that does, unfortunately, cost money in the reality. So the more you advocate back for us, the quicker we can serve you, serve your needs. So I'd like to thank Victoria and Alex very much for a fantastic presentation. You've already done my job as well by highlighting what's coming up next in this week. So please do join us for the other sessions. And thank you everybody for your time. And it's great to have such wonderful feedback and to work with all of you.